And as many head out to celebrate New Year's Eve tonight, some are wondering if they should get tested in the next few days. CW50's April Morton is talking to medical professionals on what you need to know to stay safe.
As COVID-19 cases hit an all-time high, doctors say some gathering in large crowds this New Year's Eve may want to get tested in the coming days. As the holiday gatherings come to an end, doctors are preparing for the beginning of a possible new COVID-19 surge.
All hospital systems are preparing. We know that from the past, after every holiday, there is always, unfortunately, somewhat of a surge in cases.
And with the Omicron variant skyrocketing, doctors say in some circumstances, if you've gathered in large crowds, a COVID-19 test may be needed.
If you were in a large gathering and you know that you were exposed to someone that had symptoms or who did end up testing positive for COVID-19, I would suggest that you go ahead and get tested.
While waiting for those results, doctors say to quarantine for at least 5 days. On the other hand, if those who gathered are all vaccinated, she says you can probably wait a few days to be tested if you choose, but be on the lookout for any flu-like symptoms. So what happens if you do test positive?
So if your COVID test is positive and you're asymptomatic, you should quarantine for 5 days. And then after those 5 days, you can go back out in the public if you have to, but wearing a mask.
For those using a home test, health officials say for the most accurate results, test 3 to 5 days after exposure. But PCR tests are the gold standard for the best results. Most importantly, if you are positive, symptomatic, or not, staying quarantined is critical.
So if you're carrying the virus and you go out in public, you could be infecting someone else and putting their lives in danger. And so really the recommendation is if you're positive for COVID, you should stay home.
April Morton, CW